So our next presenter was also a recipient of the Jamie Castle's Undergraduate Research Award, and we are very proud of her as well as all our soon-to-be graduates. And this is Alex Kent, and I'm happy and proud to introduce you to her.
Thank you for the introduction. Does this work? I have to click on. Neat. Can you guys hear me? All the way in the back? Yeah? Let me know from Kathy. Perfect. Okay, so it looks like we're ready to go. Let's see this is perfect. So as Lynn mentioned, I'm Alexander Kent. I'm in the BA program and I study Indigenous health. This presentation will provide a brief overview of the exciting work I got to do for my practicum. I had the privilege of doing my practicum with the Center for Aboriginal Health Research under the mentorship of Dr. Charlotte Redding. CAR is a research center dedicated to promoting, supporting, and conducting health research in partnership with Aboriginal peoples. My practicum was a research mentorship focused on researching health governance and self-governance within First Nations communities. For my research, I used qualitative document analysis to investigate current governance structures as a contributing factor to inequitable health among First Nations. Furthermore, I explored self-determination as a means of empowering First Nations communities to take control over their health and well-being. The strategies I employed to address this research objective can be divided into 3 steps: planning, literature review, and data analysis. One of the first tasks I had was to create a research proposal and plan which outlined my purpose, objectives, positionality, lens, methodology, topics for analysis, key authors, and relevant case studies. Before I started my literature review, I took advantage of the many sources I had from previous courses. These sources also pointed me in the direction of other articles, which I then searched using online databases and search engines. I triangulated my data using different types of sources, such as journal articles, government documents, and policies. I was unable to find many policies that directly related to health governance on First Nations communities. I started identifying and analyzing themes while collecting the data. Once there was significant overlap and repetition of content, I moved on to coding and categorizing my notes. I organized my notes using headings, color coding, and endnotes. I then used a mind map to recontextualize and visualize my themes, which was very effective and helped me create a Prezi to present my findings at the research fair. This is the Prezi, or the basic template, and this is me at the research fair with my mentor. Shout out to Charlotte. The literature review revealed a disproportionate burden of inequitable health among First Nations communities, as well as various barriers within the current health system, including inadequate health services, fragmented governance, jurisdictional gaps, and lack of government accountability. The research also highlighted self-governance as a solution for First Nations communities to reclaim control over their health. Thematic analysis drew attention to several key features of a sustainable system of self-governance, including recognition of sovereignty, a voluntary process, and the support of a fiduciary relationship. Given these key elements, I propose that a multi-level mosaic model of self-governance offers increased control over health governance in such a way that is proportional to their capacity and needs. Principles of cultural safety and recognition of diversity were evident in the purpose of my research, which was to propose a culturally relevant framework of self-governance for First Nations communities. Cultural safety was further embedded in my methodology through transparent positionality and decolonization lens. My research reflected critical analysis of injustices and inequities in society through a comprehensive review of the contemporary and historical context, which included critical analysis of power imbalances such as colonialism, federalism, and paternalism. I approached my research with a greater purpose of triggering social and political change at the local, provincial, and national levels. With this in mind, I directed my recommendations to a targeted audience of policymakers, scholars, and the general public. Potential areas for improvement include partnerships with people and populations served, interprofessional and multidisciplinary collaboration, incorporation of Indigenous knowledges, and community-based research. Overall, I'm very pleased with the way my research unfolded. I'm out of time, but I want to send out a huge thank you to Charlotte, of course, who's been an absolute gem, and everyone in my cohort, my faculty included. It's been a pleasure.
Questions and comments, and also people who are watching, feel free to email or tweet.
All right, I'm getting off the hook. Oh, Bronwyn, take it away.
I don't actually have a question exactly. I just wanted to comment that I think you did an amazing job, and it sounds like an incredible practicum placement, and you definitely, did great.
Thanks so much, Bronwyn.